Okay, Anthony, so now we're going to assess your abdomen. I would take some tangential lighting and I would ask him to empty his bladder before we begin. I would also ask him to bend up his both knees to relax his stomach muscles during the assessment, but due to the video, I'm just going to have him put his knees down. So I'm going to have you do that. So utilizing tangential lighting, what I would do is I would assess for any peristalsis, any pulsations, any abnormalities. I would then look at his skin. There's no scarring, his contour is flat, and his umbilicus is intact. So then I'm going to listen to his abdomen with the diaphragm of my stethoscope in all 4 quadrants. And he has positive bowel sounds in all 4 quadrants. So then what I do is I would take the bell of my stethoscope and I would assess for bruits in the aortic, renal, iliac, and femoral arteries. So listening to the aortic, renal, iliac, and then femoral, and I would do that on both sides. So next what I'm going to do is some light palpation. So Anthony, I'm just going to touch your stomach a little here, and I don't see any guarding. Do you have any tenderness?
No.
So now I'm going to use some deeper palpation. So Anthony, I'm just going to palpate your abdomen. And there's no guarding, any tenderness, Anthony?
No.
Okay, perfect. So next what I'm going to do is, I'm going to have you take a nice deep breath in and out. I'm just going to feel for the border of your liver. Okay, so I'm just going to take a nice deep breath in and out, and once again, in and out. And I could feel the border of his liver right there. I'm going to do the same thing over here on the right side. Can you take a nice deep breath in and out, and I can feel the border of Anthony's spleen. Now I'm going to percuss his abdomen. And Anthony's abdomen is tympanic in his upper quadrants. In the lower quadrant, especially the left lower quadrant, there is a little dullness there, which is a normal finding. Now I'm going to percuss out Anthony's liver. So what I'm going to do is I'm going to start at the nipple line and the right mid-clavicular line here until I hear dullness. Okay. And then what I'm going to do is I'm at the umbilicus on his right side here. I'm going to palpate until I hear dullness. And it's right there. And at this point, what I'm going to do is I'm going to measure it out in centimeters. And his is about 6 centimeters. And that is a normal finding. So now, Anthony, what I'm going to have you do is shift your body a little towards me. And what I'm going to do is I'm going to go to your anterior axilla on the right side, around the 5th to 6th intercostal space here. And I'm going to palpate out for dullness. And I see right here is a spleen dullness right there. Okay, and something else I would do, I would assess his inguinal nodes, and I would palpate his femoral artery, and also auscultate for bruits. So next, Anthony, what I'm going to have you do is do a crunch for me. Good, you have nice strong stomach muscles. So at this point now, we're gonna assess his lower extremities. I'm gonna do a skin assessment. His skin is warm, tan and dry. His skin is intact, no redness. He has no scars there. There are no distinct venous patterns present, no edema. Both extremities are equal in size. There's no warmth to either calf. I check both sides. Next, I'm going to check for pulses. So I'm going to have you bend your knee up. I'm just going to assess the popliteal. And that is a +2 finding. Next, what I'm going to do is I'm going to assess the posterior tibial on both sides. And that is +2. And the dorsalis pedis on both sides. Okay, +2 finding. So next what I'm going to do is I'm going to assess range of motion and strength of the hip. I would palpate for tenderness on both sides. And first thing I'm going to ask you to do, Anthony, is raise your leg straight up as far as you can. Good. You can put it down. Next, what I'm going to ask you to do is abduct, just to take it out to the right, and then take it back in and across. Very good. Okay. So next, Anthony, what I'm going to have you do is bend your knee, and I'm going to have you internally rotate and externally rotate. Very good. I'm going to have you push up on my hand right here, and then push down. I'm going to have you push in, and then I'm going to have you push out. And Anthony has +5 strength with full range of motion of his hip. So next what I'm going to do is palpate his knee, assess the joint for any tenderness, warmth, or pain. Are you having any pain there?
No.
Okay, so next what I'm going to do is I'm going to have you bend your knee, and I'm going to have you push out on me with your knee, and then push in. Very good. Next what I'm going to have you do is, okay, I'm going to assess down to the ankle joint, assess the Achilles, and go down to the toes. And there's no deformity or tenderness there. Okay, I'm going to have you take your feet, can you put them towards you? Towards you. And then down. And then internally. And then externally. Very good. So you have full range of motion of your ankles. I'm going to have you press down with your feet on my hands. Very good. And you have +5 strength. So next thing I'm going to assess for is coordination. So what I'm going to have you do, Anthony, is bend your right leg up and have you take your ankle to your knee, and I'm going to have you trace it down to your great toe. And this assesses for coordination, and I would make this assessment on both sides.